Hello everyone, and welcome. I'm excited to kick off our presentation today with episode 25. This is our first slide, so I want to start by thanking you all for being here. Today, we'll be exploring some fascinating insights and stories that I think you'll find really engaging. We'll cover the main themes and key points in a clear and straightforward way, so you'll come away with a good understanding of the topic. But for now, let's get started and dive into what's ahead. Let's talk about some important teaching points for neutropenic clients and their families. When caring for someone with neutropenia, we need to be very cautious about infection risks. So, the question here is, which statement should the nurse teach the patient and family to avoid? Looking at the options, performing oral hygiene after every meal might seem like good care, but we have to ensure that the tools used are sterile and gentle. Using suppositories or enemas, however, can introduce bacteria directly into the bloodstream or rectal area, which is risky for neutropenic patients. Performing perineal hygiene after each bowel movement is actually recommended to help prevent infections, as long as it's done properly. And wearing a filter mask can be a useful protective measure, especially in crowded or infectious environments. So, the key takeaway is that using suppositories or enemas is something we should advise against in neutropenic patients because of the increased risk of infection. This aligns with the overall goal of minimizing infection risk and protecting vulnerable patients in our care. Now, let's talk about using suppositories or enemas. These methods are often used when oral medications aren't suitable or when a quick effect is needed. Suppositories are inserted into the rectum, where they dissolve and deliver the medication directly into the bloodstream or local tissues. Enemas, on the other hand, involve introducing liquid into the rectum to stimulate bowel movements or deliver medication. It's important to follow proper techniques to ensure safety and effectiveness, such as wearing gloves and positioning the patient comfortably. While these methods can be very effective, they require careful attention to hygiene and patient comfort. Remember, selecting the right method depends on the patient's condition and the medication involved. This approach ties into the overall theme of understanding different routes of medication administration to optimize patient care. Neutropenic clients are at a particularly high risk for infection, so we need to be very cautious with their care. One important point is that using suppositories and enemas can sometimes cause trauma to the rectal mucosa. This damage can create an entry point for bacteria, which might then enter the bloodstream and lead to serious infections. Therefore, when caring for neutropenic patients, it's crucial to handle these procedures gently and carefully to minimize mucosal injury. This is part of our overall goal to reduce infection risk and keep these vulnerable clients as safe as possible. Let's discuss some key infection control practices. First, performing oral hygiene after every meal is essential. This simple step helps prevent oral infections by removing food particles and bacteria that can cause issues like cavities or gum disease. It's a quick but effective way to maintain oral health and reduce the risk of complications. Next, performing perineal hygiene after each bowel movement is crucial. Keeping this area clean significantly reduces the chance of infections, especially in vulnerable patients or those with limited mobility. Good hygiene here supports overall health and comfort. Finally, using a filter mask is an important protective measure. It helps shield us from airborne pathogens, especially in settings where there's a risk of inhaling infectious particles. Wearing masks properly is a key part of preventing the spread of respiratory infections. All these practices tie back to the overall goal of infection prevention and control, which is vital for patient safety and our own health. Neutropenic clients should avoid rectal procedures such as using thermometers, suppositories, or enemas. The reason for this is to prevent any risk of infection, which their weakened immune systems are especially vulnerable to. It's really important to understand that even minor trauma or introducing objects into the rectal area can introduce bacteria and lead to serious infections. So, as healthcare providers or caregivers, we need to be vigilant and ensure alternative methods are used for temperature measurement or medication administration when possible. This simple precaution aligns with the overall goal of protecting neutropenic patients and maintaining their safety during treatment.